Today we're going to start by discussing ethical issues in counseling practice. You should have read Chapter 3 of your textbook. When we talk about professional ethics, most professions have some form of a code of ethics, and especially in the counseling profession, these are a fundamental component of effective counseling. There are guidelines that outline our professional standards of behavior and practice. They don't make decisions for the counselors, but if you are unsure about a situation, many times our code of ethics will give you some direction on that. But counselors have to interpret and apply the ethical codes to their own decision making. And this is where it's helpful if you have a supervisor or other therapist that you can consult with. There's 3 different types of ethics. First, we have the mandatory ethics. This is just the basic, what's expected. It deals with the minimum level of professional practice. Then we have the aspirational ethics, which are a higher level of ethical practice. And then the positive ethics. This is an approach that's taken by practitioners who want to do their best for clients rather than simply meet the minimum standards to stay out of trouble. When you're trying to make ethical decisions, some basic principles are to remember are your actions need to benefit others, do no harm, respect others' autonomy, be just, fair, and faithful. And as we look at our ethical codes or code of ethics, they educate us about the responsibility that we have as therapists. They give us a source of accountability. They're there to protect our clients and ultimately to improve the professional practice. On Module 2, under Handouts, I've included a link to the ACA Code of Ethics. This is the American Counseling Association. I would like for you to look through those and you'll kind of see the things that are addressed in a professional code of ethics. Also involved in making ethical decisions is the process of identifying the problem, whether it is a situation where you don't know whether to break confidentiality, you're wondering if this is a dual relationship, your counseling client wants to give you a gift. I mean, there's a multitude of issues that could come up. But what you need to do in making an ethical decision is to identify the problem, then look through your code of ethics and find the ones that are relevant to that. If you still can't figure it out from reading that, then seek consultation. Talk to a supervisor or another therapist or someone that has kind of mentored you. Brainstorm the issue, look at the consequences, and then be sure and document the reasons for the action that you took. That way, if it is ever called into question later, we can see the process that you went through to arrive at your decision. And if possible, include the client in your decision-making process. Most of the time, their understanding of the ethical and legal limitations that are in guidelines that you have to work under. When we talk about informed consent, we're talking about the information that clients need to know to be able to make a decision. And it's important that clients have enough information about the counseling process to make informed choices. Another thing that we do usually either in the intake paperwork or the initial meeting with our client is to educate clients about their rights and responsibility. In this informed consent, you should have information about the therapeutic procedures and goals, the risk and benefits of therapy, the client's right to withdraw from treatment, how much it's going to cost. This may also include information about insurance and filings and things. If you are a therapist that's under supervision, you need to be sure and let them know that. And then also the limits of confidentiality. When we talk about the limits of confidentiality, it's very important that our clients have a good understanding of what is confidential information and then what are the situations where that confidentiality may be broken. Usually we let our clients know that everything that goes on in this session is confidential. with the following exceptions. If a client poses a danger to self or others, if they disclose that they are considering harming themselves or harming someone else, then you have to break confidentiality and let someone know. Clients who are under age 16, or if they're dependent adults, or if they're older adults who are victims of abuse. If the client needs to be hospitalized, it may be necessary to disclose some information. If information comes up in a court action and you receive a court order or court mandate to turn over information, you have to comply with the judge's order. Or if the client requests a release of record, you would have a form for release of confidential information. On this form, it would indicate what information the client was giving you permission to disclose and to whom or what entity you were being requested to disclose that information. When we go through the assessment process, this is the process where the counselor evaluates the client's psychological functioning. If you remember from your video last week, we talked a little bit about the initial interview and some of the things that you would take into consideration. Based on the therapist's theoretical orientation or their theory of counseling, the assessment may take some different directions. It requires a cultural sensitivity, and I believe also just a sensitivity to the client's personality and their level of comfort with the counseling process, and just trying to follow along with what they seem comfortable disclosing initially and what things maybe you need to just make a note of and come back to later on in the process. But during the assessment, we'll not only be listening to what the client says, but you'll also be paying attention to the words they use, the facial expressions. We may look at their dress, not in a judgmental way, but are they messy and disheveled and look like maybe they just rolled out of bed and came? Or are they neat and fixed up and alert? So you're just making notes of those things, and they all come into the assessment process. And these things can be helpful to you as you're planning your treatment or subsequent counseling sessions. When we make a diagnosis, basically what we're doing is we're looking at the pattern of symptoms that the client has displayed and matching them with the diagnoses that are outlined in the DSM. It's now 5, has just recently come out. This is the Diagnostical and Statistical Manual that we use for diagnosing psychological disorders. It gives you a lot of information about the symptoms that you're looking for, the length that the symptoms need to have gone on, the amount of discomfort that the symptoms are causing the client, and those types of things. Sometimes counselors don't feel like it's necessary to make a diagnosis, and if you're not filing insurance or those types of things, there's not a real reason to form a diagnosis. Is that something that you're not comfortable with? But it can be helpful in treatment planning because there have been certain therapy techniques that have been proven effective with certain disorders, and then also in cases where medication may be indicated. Another ethical issue that often comes up is multiple or dual relationships. And what we're talking about here is if you are seeing several people within one family, or maybe a couple and you're seeing both partners, or dual relationships where possibly you know this person in another setting outside of the counseling office. This is not inherently unethical, but it is a situation that has to be looked at and managed ethically in order to protect the client's well-being. Another thing that we talk about when we talk about these dual relationships, or another thing that's important to remember, is that we're talking about non-sexual dual relationships. Sexual relationships with a current or a former client, those are considered exploitive and they can result in serious harm.